In my last video, I was asking TikTok, do you know what this is and what it is for? Now, as I suspected, many people do not know what this is and do not know what it's for. So let's get into what it is. But first, my name is Madeline Golick. I'm a pelvic health physiotherapist practicing out of Mississauga, Ontario, Canada. And so let's get into what this is. So this is called a cube pessary. Okay, and pessaries come in different shapes and different sizes. Some of you may have one and it's a ring, so it's a ring and the rings come in different shapes and different sizes depending on whether the pessary is supporting a pelvic organ prolapse, or pessaries can also be used if you have incontinence. Okay, so for incontinence it probably wouldn't be this one right here. This one is predominantly for pelvic organ prolapse. And essentially, what we do with this is, if this is the canal and this is the pessary, oh, maybe I should mention what a pelvic organ prolapse is. So a pelvic organ prolapse, if you're not sure what that is when one of the organs inside the pelvis, whether it be the bladder, the uterus, or the rectum, begins to fall into the canal and or outside of the canal. Okay, so the pessary is designed to go inside of the canal all the way in. Now, unfortunately, this pessary is not fitted for this tube. So this pessary is actually too big. But the idea is that this pessary would go all the way inside and would sit inside the pelvic floor. And essentially what it is doing, it is holding things up. Okay, so pessaries are a great option, for example, if you don't want to have surgery to repair the pelvic organ prolapse. Maybe you want to delay the surgery. Maybe there are other reasons that you cannot have the surgery. Maybe your symptoms are mild, but you want additional support. So people can have a pelvic organ prolapse and not even know it. That is what we call a asymptomatic pelvic organ prolapse, whereas others may just see it visually, so it's something you see in the mirror. Some of you may feel it when you're wiping or cleaning. You kind of just see something at the opening, or there's like a bulge, and some of you may be experiencing symptoms that are impacting your ability to perform your activities of daily living. So heaviness, pressure, bulging, discomfort, sometimes pain, and or literally can see something coming out of the canal. So a pessary is kind of something that you can use alongside with pelvic floor muscle training to build up the musculature for support, and also have an external support. Maybe you're waiting for surgery, and in the meantime, you may want to have something that supports you to be less symptomatic so that you can do all of your day-to-day things without the prolapse causing you symptoms. So a pessary is a great option. So what do you need to do if you're looking into getting a pessary? Well, first and foremost, you want to speak with your family doctor. Make sure you got yourself a referral to an OBG or a specialist, urologist or urogynecologist for an assessment. Now, typically here in Canada, it is the OBs that are usually doing what we call a pessary fitting. So they basically fit to make sure that the size is right for you and that the pessary is doing its intended job, which is to support. Now, there are now pelvic floor physiotherapists that are trained in pessaries. There's few of them, they're few and far in between, but certainly you can do a Google search and find a pelvic floor physiotherapist that is doing pessary fittings. And oftentimes the wait time to see a pelvic floor physiotherapist for a pessary fitting is less than the wait time it is to see a specialist. So having a conversation with your doctor is step number one. Step number two is figuring out, is it going to be the specialist doing the pessary fitting, or are you looking for a pelvic floor physiotherapist that can do it? And so that is what this is. And if you have additional questions about pessaries or about pelvic organ prolapse, please feel free to put that in the comments and I will create additional videos for that. And as always, be sure to follow along my page for all your pelvic health information, exercises, tips, tricks. So hit that subscribe button.